and we get pretty excited about the impact that we feel RPM can have on community pharmacy and community health. But yeah, a lot of people still have some questions about RPM. So could you just take a few minutes and on a high level, tell us what RPM is?
Of course. So I know you guys hear or see the acronym RPM everywhere. What is it? And as Kelly said, it's remote patient monitoring. And what that is when a patient has one chronic condition, and clinicians such as yourself, our pharmacists, are allowed to monitor that condition from the comfort of the patient's home. And the devices that we use are usually cellular enabled or Bluetooth enabled. And those standard devices are a blood pressure cuff, glucometer, a scale, oh, I'm sorry, and a pulse oximeter. And those four devices are used to monitor whichever one of those conditions the patient has.
Good. Is it difficult for a store to get involved in it? What are some basics that a store would need to think about before possibly bringing an RPM program into their store?
So the first thing that I'm always going to say is your staff. You want to have at least one dedicated staff member that can provide the RPM. And the reason I say that is because just some examples from our pilot. Um, it is a clinical service, and there was a myth that you only needed to log in and check on the patient once or twice a week. But as you know, it's a clinical service. We need to be checking on the patients every day. So once you have that designated person, then knowing your patient population, because what device do you want to offer to the patient? It really depends on that patient population. Who are you filling your prescriptions for? Or if you have a relationship with a doctor, what disease state is that doctor treating? And as you know, and if you don't know, remote patient monitoring is not standard to one disease state. You can monitor as many as you would like.
So when you say check in with the patient on a daily basis, explain what you mean by check in.
So, Medicare guidelines, they do require 16 consecutive readings a month. So, those orally reported will not count towards those billable CPT codes. And then they want you to document on your patient and also talk to your patient within a 20-minute increment, once a month. So those are the guidelines. And when I say log in every day, it's imperative because we never know when the patient may be in distress, or something minute could have happened overnight. So when you're logging in every day and you're looking at your patient population that you're monitoring, you're able to track that data trend. And if you see something seems off or not right, you're able to step in and intervene immediately, which will stop the doctor from um, having to see a same day sick visit, or also the patient reporting to the hospital emergency room or an urgent care clinic.
So when you say log in every day, then you're checking those vitals that are coming in on a daily basis from the patient, correct? And if something's
Correct.
out of line, then you can then escalate that to the physician, correct?
Correct. So, as clinicians, as pharmacy clinicians, you are able to monitor, but there may be a situation where it's out of your hands and you do have to reach out to the provider.
Mhm, mhm.
So, when I say log in, that's what I do mean, that you're checking on those patients' vitals every day. And if something is not, it seems off, and you know that there's nothing you can do, you can go ahead and reach out to that covering provider so that they can intervene.
Great information, Ashley. Now, how should stores reach out to you for more information?
So you can go to www.myicareplus.com. At the end of this video clip, there will be a web link and also a support email that you can email. But if you're ready to start RPM, or even if you're just exploring and you need educational materials, just go ahead and reach out, and then we'll get back with you.
Good. Thank you.